Hi, and welcome back to Rise in Progress. With us today, we have Julie Novak, the CEO of Michigan State Medical Society, here to talk about the Future of Medicine project. Now, I've only been with the organization for 6 months, so this is my first time. I don't know much about it. Can you tell me what the Future of Medicine is?
Yeah, well, Kate, we started this project in 2005, and it was a survey, an interview really of healthcare leaders, government officials, business leaders, stakeholders all across the state. And the goal was to find out what people thought was important to healthcare for the next 5 years. What would be the important things to address and to cover? And that really gave us a lot of great feedback and ended up with 4 basic principles. One was safe, high-quality care for everyone. The other was wellness and healthy communities, a reformed healthcare market, and revolutionary at that time was an acknowledgement by our leadership and people around the state in these interviews that the access to care was really driven by everyone having coverage, healthcare coverage or insurance. And that was way ahead of Obamacare or Medicaid reform or Medicaid expansion. And so that was really the beginning of it in 2005. And in 2006, we spent a lot of time talking to groups, sharing this information, and it really did influence our advocacy agenda and the work that we did for physicians for many, many years. And before the pandemic started, in pre-pandemical times, as I think of them, we decided it was time to revisit that. And this time we focused on even more physician interviews than before because we knew that there were physicians in a lot of administrative positions, in a lot of leadership roles in organizations like insurers and business settings, in state government. And we wanted to get a little bit more emphasis on what the physicians in those new roles, which weren't as common back in 2005, were thinking. And so that was the basis of what we did this year, starting to think about it pre-pandemic. With the pandemic, it made all of the things that we need to understand about where healthcare should go going forward even more important because of all the things that we were seeing going on in the healthcare system at the time.
So you've gotten the results of those surveys and interviews back now. What have we learned from the updated 2021 version?
So one of the things that's appeared, again, is physician leadership and partnership with other stakeholders is very, very important. And we know that because healthcare has a lot of different aspects to it and a lot of decision makers in it. Social determinants of care or social determinants of health and health equity are clearly much more in the forefront now than they were in 2005. And that was evident in all of the interviews that we did with the physicians and other leaders in this current version. And the other things were, sort of how do we engage in continued market reform around value-based care, risk-based care, and team-based care, which is much more of a conversation now because we know that a well-functioning physician-led team is the best outcome for patients and for community health as well.
Where can our members go to learn a little bit more about this whole project?
At the MSMS website, which is www.msms.org/FOM 2021. That will be the current report. Lots of results, lots of details to the questions and information that I think everyone will find useful and helpful.
All right. Well, thanks so much for joining us today, Julie. We really appreciate it.
Thank you.